Welcome to the National Headache Foundation's Alternative Therapy and Headache webinar. Today we are joined by Dr. Alexander Moskop. Dr. Moskop is the director and founder of the New York Headache Center. He is a board-certified neurologist with subspecialty certification in headache medicine. Dr. Moskop has been conducting research in the field of headache for over 25 years, and he has published numerous articles in the scientific journals. Dr. Moskop is a licensed acupuncturist and author of The Headache Alternative, a neurologist's guide to drug-free relief, and What Your Doctor May Not Tell You About Migraines, the breakthrough program that can help you in your pain. Dr. Moskop, thank you for joining us.
Thank you for having me. It's a pleasure to speak, especially on one of my favorite topics, complementary and alternative therapies for headaches. Although I should tell you that New England Journal of Medicine, the leading medical journal, once said in its editorial that there are no alternative therapies, there are only proven and unproven therapies. And they're right. Fortunately, there have been a lot of research going on in so-called alternative therapies. We usually mean alternative therapies when we refer to things that are not pharmacological, don't involve drugs. And more people are interested in non-drug approaches because the perception is, and it's often the correct perception, is that these treatments are safer than medications. And they often can be as effective. So we will cover several things here. First, let me tell you what we do with people who come to our clinic. Obviously, we first try to find out exactly what's wrong with them before we begin any kind of intervention. Because if you are treating the wrong thing, it's not going to work. It's going to hurt the patient. Once we establish correct diagnosis, and usually that's done by taking a very careful history rather than doing all kinds of tests. We do some blood tests. Occasionally we do an MRI scan. But most of the time, the history is the crucial part. Then we try to eliminate triggers that make the headaches worse. Triggers, there are some modifiable triggers we can help, and there are some that are not. And the cause, though, of most headaches, particularly migraines are the most common type of headache. Migraines, unfortunately, are inherited. So when people come and tell me I want to find out the cause of my headaches, half jokingly I say that the cause of your headaches is your mother. People often laugh, but in fact it's true. It's a genetic disorder. But the good news is, even though you have this genetic predisposition, good news is that many triggers make headaches worse, and eliminating triggers can make a huge difference. Then we move on to lifestyle changes, things like sleep and diet, and then we discuss non-pharmacological approaches, treatments, and then we talk about drugs, preventive and abortive drugs. Abortive means we take it only when you have a headache. Prophylactic drugs means you take them daily. I really don't like giving daily medications to patients. Botox injections, botulinum toxin, is definitely safer than daily preventive drugs, and it definitely has a place in our treatment. But that's on the bottom of the list, Botox and then drugs. So triggers, food is a big trigger, and for most people it's pretty obvious. Wine gives a person a headache. They know not to drink wine, or it's sharp cheeses, chocolate. Occasionally it's wheat, gluten that causes headaches, but not very often. Environmental triggers, bright light, loud noise, pollution, weather. These things commonly associated with migraine headaches. There are hormonal triggers, which we can also manage in women with hormonal headaches. Weather we can't do much about, but there are some treatments that will also relieve weather-related headaches. We can talk about those as well. The lifestyle changes, sleep. If a person comes and tells me lack of sleep gives me a headache, fortunately there's not much you can do. I don't have a magic pill that will replace sleep. People still need to get enough sleep to avoid headaches, and they often need to sleep on a regular schedule, going to sleep at the same time, waking up at the same time. Too much sleep sometimes gives people headaches as well. And so do sleep disorders like sleep apnea. People who snore often get headaches because they don't get enough oxygen to their brain when they sleep. One of the best, the most effective treatments, scientifically proven treatments, is regular aerobic exercise. Studies have been done in Sweden showing that there was a strong correlation inverse correlation, meaning that the more you exercise, the fewer headaches you have. And they looked at 45,000 people. And then they actively took a group of migraine sufferers and gave them exercise. 30 minutes, actually they did the opposite, 40 minutes 3 times a day. And they found that there was equal improvement compared to people who were taking Topamax, the pyramate, a drug for epilepsy that we use for migraines, and people who did biofeedback relaxation training. Except, of course, the only group that had side effects was the group with Topamax. Regular exercise was equally effective without the side effects and with many potential other benefits. Avoid smoking, drugs, commonsensical things. Then we discussed with patients after aerobic exercise relaxation training, biofeedback, because stress is a big contributor to headaches. So biofeedback is something that teaches you how to control stress better. All the other treatments here on the screen don't have as much scientific proof as biofeedback, except for progressive relaxation, which is very similar, and possibly by meditation. Those things have good science behind them, and using these techniques, you can definitely improve not just your headaches, but overall quality of life. And behavioral therapy is also very good. Changes the way you look at things. We often talk about changing the locus of control from external to internal, meaning that external locus of control means people think things are happening to me. Why am I getting these headaches? I can't do anything about it. Internal locus of control is taking charge of your health and doing things and running biofeedback and exercising, meaning that you do have a great degree of control over your headaches and can find ways to treat them, whether it's with herbal treatments or even medications. But you really can take charge and be much more successful than if you just think that things are happening to me, I can't do much about them, go to the doctor, do something, fix my headaches. This is the study I just mentioned, physical activity of headaches, results from a large study of 46,000 patients, actually not patients, healthy individuals who were in the computer database in Sweden. They found to have really good, strong correlation between the exercise and migraines. And this is the subsequent study they did with 91 patients using aerobic exercise for pyramid, Topamax, or relaxation training, all 3 equally effective. Now let me talk a little bit about magnesium and migraines. Magnesium has been my area of research for many years, almost 20 years now. And we do know that people who have migraines tend to have low brain magnesium, but not just brain magnesium. This is the study on the screen that was the first study, scientific study showing that lack of magnesium was present in people's brains who have migraines compared to healthy controls. The whole body actually is deficient in magnesium. This is a scientific study. I don't want you to read all these details, but the bottom line here is that another study showing that migraine and cluster patients had low magnesium levels, specifically in the occipital lobes, the back part of the brain. And this is yet another study showing that if you give magnesium load to people with migraines, they retain a lot of more magnesium than people who don't have migraines by measuring how much magnesium is excreted in urine. And we have at least a dozen or more studies showing that magnesium deficiency, in fact, is present in people who suffer from migraine headaches. At least 50% of people with migraines are deficient. So it's not everyone, but many, many people. People often ask me what are potential causes of magnesium deficiency. And stress, we often talk about stress, and we talk about biofeedback and exercise. But stress causes headaches possibly through depletion of magnesium. Because when you lose magnesium, the blood vessels are going to spasm, they constrict, and many other bad things happen in your body because of a lack of magnesium. So stress is one trigger. Genetics. We have families coming in, and they're all deficient in magnesium because they are not absorbing magnesium from their diets. Normally there is sufficient magnesium in the regular diet, but some people don't absorb it. I have these families who, even taking supplements, their magnesium levels don't go up in their blood. So we have to give them monthly infusions of magnesium intravenously. And then low dietary intake. People are eating not very healthy foods. Magnesium is usually found in whole grains, dark leafy vegetables. Next cause of magnesium deficiency is alcohol and caffeine as well, but more alcohol depletes your body of magnesium. Taking calcium supplements can lower your magnesium levels. So calcium magnesium supplements, so often if we give people magnesium supplements, we tell them to take them separately, not at the same meal. Many migraine sufferers also have gastrointestinal disorders such as irritable bowel syndrome, which prevents absorption of magnesium. Chronic illness like diabetes or any other chronic illness also depletes your body of magnesium, and all that can make your headaches worse. And the other symptoms of low magnesium besides headaches, leg muscle cramps. People often think it's potassium, but very often it's magnesium. And then cold hands and feet, or feeling always cold. I often can tell the person has a magnesium deficiency because they walk in the middle of the summer wearing a sweater, or they shake their hand and their hand is very cold. In women, premenstrual syndrome, PMS symptoms, mental fog, irritability, all these are signs of magnesium deficiency and can be all helped by magnesium oral supplements or intravenous injection. This is a scientific study we did infusing magnesium intravenously because we wanted to prove the idea that magnesium actually helps headaches. So we gave 40 consecutive patients who walked into our clinic intravenous magnesium, and we found that half of them responded. And when we looked at the results of the tests, we found that the responders, 85% of them had low magnesium levels. People for whom magnesium didn't help had normal levels of magnesium. And the same we found in cluster headache patients, same correlation. So 40% of cluster patients and 50% of migraine patients we found were deficient. And this is a study from Germany showing that taking magnesium supplements reduces attack frequency by 41.6% compared to 15.8% in the placebo group, people who were taking a sugar pill. And the days with migraines were reduced dramatically as well. This is another Italian study showing that taking magnesium not only helped migraines significantly, but also menstrual distress questionnaire score. Those PMS symptoms improved as well. And this is a study in children. Kids often suffer from migraines, and giving children magnesium is also very safe, and this study showed that it actually helps kids as well. And this is one study that showed that magnesium didn't work, but the problem with that study was diarrhea happened in almost half of people with magnesium and only a quarter of those with placebo, meaning that they picked the wrong magnesium salt to give their migraine patients, and that's why they didn't improve. Which brings up the question, which kind of magnesium do we use? And these are, again, scientific studies showing that magnesium oxide or chelated magnesium, both are pretty well absorbed. Chelated is also called diglycinate, and there are other kinds of chelated forms of magnesium like gluconate and aspartate and many others. So we usually start oral supplementation of magnesium with 400 milligrams of magnesium oxide. This is the cheapest supplement, costs about $3 a month supply. And we recommend taking it with food, so you just reduce the chance of diarrhea. And if it does happen, diarrhea, then you try chelated magnesium, or you try other kinds of magnesium salts, magnesium citrate, and chloride, and many other ones. And if that doesn't work, we increase the dose if patients don't get diarrhea. And occasionally, as I mentioned, we have to give people intravenous infusions. A little commercial here for my product. I have to tell you that I have a potential conflict of interest because I developed this combination of aspirin with magnesium. Magnesium here does three things. It helps for headaches, as I mentioned before. It also is a buffering agent, so it reduces the acidity of aspirin, so it's not as irritating in your stomach as plain aspirin or Excedrin. And magnesium also improves absorption of aspirin. So it's a nice, quick-acting combination that so far you can buy it only on migraines.com or Amazon.com. Many of my patients are very happy with this over-the-counter headache medicine. Riboflavin is a vitamin that's also can be effective. It's vitamin B2 at a big dose. 400 milligrams has been shown to prevent migraines in some people. Genetic studies show that some people are deficient in the vitamin B12, and they have high homocysteine level. It's a blood test that we do. So taking B12, B6, and folic acid has helped some people, especially those who have migraine with aura, visual disturbance that precedes the migraine. Coenzyme Q10, one more supplement that we use, which has been studied in good scientific studies, 300 milligrams a day of coenzyme Q10, which also gives you energy and is good for your heart. And this was a study done on children showing, again, kids, besides magnesium, we recommend kids take CoQ10 because fully 1/3 of kids were deficient. And this very large study by Dr. Andrew Hershey. Out of 1,550 kids, a third was deficient. So giving kids CoQ10 is another good supplement. So maybe we should stop now for a few minutes and take some questions if there are any questions. Otherwise, I have more slides to show you.
All right, it looks like our first question comes from Suzanne. Can you tell us a little bit about natural herbs such as feverfew, butterbur, white willow, and their effectiveness for chronic headache and migraine?
All right, how did you know that my next slide was botanical remedies? I promise that was not a setup. I stopped at the right moment. So feverfew is a very old herb. It's been around for, mentioned to be used in medicine for over 100 years. And problem with feverfew and every other botanical product, these are plants. It's like if you think about wine and grapes that wine is made of, many factors play a role in how the wine tastes, where it grows, what kind of sun it gets, what kind of minerals in the soil. Same with these herbal products. Even the best intentions, manufacturers often have totally different products depending on where that plant grew. Germany is far ahead of every other country in the world in developing herbal products, and the government there regulates very strictly the herbal products as strictly as drugs. So this was a company that developed a very purified extract. Unfortunately, we can't buy it here. So we have to rely on just regular feverfew, a plant that you can grow yourself, and people often just chew the leaves or make teas, all kinds of brews. And this study that is very purified form did show that people with migraines actually benefited from feverfew. This is the result of the study. Number of attacks went down, not dramatically, but there was improvement. And there were no side effects. That's the nice thing about feverfew. So it's a very safe plant. You can grow it. You can eat it in any form, which is not true for all herbal products. But feverfew is worth trying. But what I recommend that patients buy big brands, that is recognizable brands. You go to GNC store, or Solgar is a good brand. Those companies usually make sure that they have a good quality and pure products that will not hurt you. So don't buy the cheapest one, buy recognizable brands. You have a better chance of getting something that works. Now, butterbur is something we studied extensively. I was one of the authors of this study of butterbur that looked at 245 patients, and we divided them into 3 groups: placebo, sugar pill, 100 milligrams and 150 milligrams daily to prevent migraine headaches. And it was published in a leading neurology journal called Neurology in 2004. The results were very impressive. People who took 150 milligrams had significant improvement compared to people who were taking a sugar pill. So we think that it's an effective herbal product. The only problem with butterbur is that it is a toxic plant. So do not grow your own butterbur, and do not collect leaves or any other part of the butterbur, which is also a common plant, just like feverfew, found everywhere. But it is a toxic plant. It has chemicals that can cause cancer, and they're terrible for pregnant women. So it has to be a very highly purified product, which this German product was. And it met all the strict standards of German government, except at one point the company changed their extraction method, purification method. And the German government actually stopped them from selling butterbur, sold under the brand name Petadolix in Germany. So that made me feel a bit uneasy. If it's not sold in Germany, I'm not sure I would want to recommend it to my patients, although it is probably safer than any other butterbur product you can buy in the U.S. because, again, there is no strict control in the U.S. compared to Germany. So American products could be much more dangerous than the German. Some of them, and many of them, could be perfectly safe and effective, but we don't know which ones. So I'm a bit reluctant recommending butterbur in general to my patients, but we still talk about it. So this is the reason. We no longer recommend butterbur because of raw butterbur having all these dangerous ingredients. And again, in Germany it's not sold, so that made me a bit concerned, although I think that the company is very responsible. It's a very old, established company, And I don't think they would sell a dangerous product, but still some doubts remain. Now, there's another herb that I did not make a slide of, and that's Boswellia, spelled B-O-S-W-E-L-L-I-A. Boswellia seems to work for even very severe headaches. These small reports, they're not studies like we did with Butterbur, comparing Butterbur to placebo. It's more of a anecdotal reports, we call them. 23 people responded to a Boswellia supplement with very severe headaches, cluster headaches, and a group of headache called indomethacin-sensitive headaches. So Boswellia is something to consider. This is a study, again from Germany, using peppermint and eucalyptus oil. Just smelling it, rubbing it in your skin seems to not necessarily help the headaches, but improve pain. This is a combination of peppermint and alcohol, ethanol, had an analgesic effect, meaning pain-relieving effect, muscle-relaxing effect, and mentally relaxing effect, which was not present with other herbal extracts. So this is a bit about herbal products we use to treat headaches. Ginger is another thing I should mention, which is very good for nausea. Fresh ginger is the best, but not ginger ale, which has very little real ginger. So you buy ginger, either a root of ginger in grocery stores or in sushi stores. Do we have any more questions?
Yes, we have quite a few. Our next question is vitamin B suggested daily for headaches?
One study showed that half of the people with migraines had a deficiency in vitamin D, and I do routinely check all my patients for vitamin D levels. We do not have any studies showing that taking vitamin D will help your headaches, but thinking logically, if you're deficient, you should probably take a supplement to correct your deficiency, but we don't have any information about vitamin D helping headaches. We do have many studies showing that vitamin D clearly affects the nervous system. People who have low vitamin D have more outbreaks of multiple sclerosis, that is, more attacks of multiple sclerosis. We have some evidence suggesting that people who develop Alzheimer's compared to people who didn't have more likely to have vitamin D deficiency, as well as vitamin B12, by the way. B12 and D are important, although neither one has studies showing that taking those will help your headaches. But if you're deficient, I would strongly recommend taking a supplement. And the recommended dose recently was raised, I think, from 200 a day, but the government agencies do 800 milligrams units a day. But I usually tell people if you're really deficient, you should take at least 2,000 or even 5,000 units daily. So that's the story about vitamin D.
Have there been any known studies for Bach flower remedies to aid in headaches?
Bach flower remedies are homeopathic products. Homeopathy has a long history, but unfortunately homeopathy still lacks good scientific basis. And as I mentioned in the beginning, we try to use only those treatments that have good science behind them. On the other hand, I will occasionally prescribe homeopathic remedies to my patients, especially people who feel like they have to take something or else the headache will go out of control. So instead of taking Excedrins and other bad drugs, or even Tylenol, I told them take homeopathic remedy, and some days they work. Because they're totally benign. They're not very expensive. Every pharmacy, mainstream pharmacy now, carries homeopathic remedies, and if you find one that says headache, it's okay to try, but there's no science to show whether they work or not.
Our next question comes from John. Has chiropractic manipulation proved to be of any use in migraine treatment and or cervicogenic headache?
Another controversial area. So chiropractic manipulations are performed millions of times in this country, very popular treatment, and I certainly recommend that to my patients who have low back pain. I'm a bit more hesitant with the neck, and if someone is interested in trying chiropractic, I make sure to tell the person that they insist that the chiropractor does not perform any high-velocity manipulations. High velocity meaning jerking the head, adjusting your neck, which can lead to strokes. I personally have seen one person who had a stroke after this. It's extremely rare. Overall, chiropractic is very safe. And if they are gentle and don't suddenly jerk your head in one direction and the other to crack your neck, as people say, If they don't do that, it's probably safe. There's no science proving that it really does anything for migraines. It's very relaxing. Some people really like it, go every week for adjustments. The only other downside to adjusting the neck, it can stretch your ligaments. That is, it can cause what we call habitual subluxation. The joint comes out of place in the neck, and the chiropractor puts it right in place by stretching the neck and putting it back in place. But doing that regularly, once a week, or every other week even, or even some people do it even more often, may stretch those ligaments and make you more prone to having your neck go out of place. So it's okay to use for an occasional acute pain if that makes you feel good. If there's some massage involved, it's even better. So it's okay, but as long as there are no sudden movements in chiropractic manipulation.
Our next question comes from Alexa. She's currently taking 400 milligrams of magnesium daily. She'd like to know what your recommendation would be for magnesium before and or during her menstrual cycle.
Right, 400 is what's recommended. That's the usual U.S. Department of Agriculture recommended daily allowance for magnesium is about 400 milligrams. And that's what we start with. For most people, that's sufficient, and they take it and they get good relief of their menstrual headaches, PMS symptoms, muscle cramps, and other symptoms that magnesium deficiency might cause. Some of my patients need more. They have to take 400 twice a day or even 3 times a day with meals, as long as, again, it doesn't give them diarrhea. So you usually go by the response. If the person feels better, that's enough. If not, we go up. The only people who have to be very careful taking too much magnesium are people with serious kidney problems, because it's excreted in kidneys and through the kidneys, and with kidney disease, you can actually have dangerous side effects from magnesium if you have too much of it. But most people with serious kidney disease know that they have kidney disease. It's rarely undiagnosed. So for most people, it's safe. But if you have any doubts or if you have any medical problems, it's better to ask your doctor. But magnesium is very good for conditions like diabetes. Diabetics are low magnesium. High blood pressure, very good for many other medical problems. Asthma. People with acute asthma attacks sometimes get intravenous magnesium in the emergency room. It opens your lungs. It's been tested for stroke victims because magnesium opens the blood vessels, improves blood flow. So there are many good benefits from magnesium supplements.
Our next question is also about magnesium. Colleen says every time she takes magnesium, she gets a migraine, usually in the form of magnesium hydroxide, citrate, or carbonate. What do you think is going on?
Anything is possible. Every single drug we use to treat headaches can cause headaches. Supplements are much, much less likely. I cannot explain that. If she's tried different magnesium forms and they all give headaches, the only thing I can think of is because magnesium opens the blood vessels. Some people are very sensitive to the opening of blood vessels, and that is why they often get headaches from exercise or sex. So that's the only possible explanation. So if something gives you headaches, don't take it. That's pretty common sensical approach. If something helps, take it. So other supplements can be tried, and other non-drug approaches can be tried.
Michelle would like to know what alternative therapies can you recommend for hormonal migraines?
Again, all of the above, the ones we mentioned, but particularly magnesium, since we know that magnesium can cause migraines, PMS symptoms. So magnesium is number one, but then going down the list, everything else. Regular exercise will improve your resistance to headaches caused by any trigger, whether it's the weather or hormonal factors. Same with biofeedback, because very often people will tell me, I don't get a headache from just one cause. By the way, I personally suffer from occasional migraines, and I usually need 2 triggers: lack of sleep and wine, or lack of sleep and stress. I might get a headache, but by itself, one trigger may not do it. Same with menstrual or weather-related headaches. If you are premenstrual and you have stress, you will get a headache. Other times the same stress may not. Or a glass of wine may give you a headache when the weather is bad, before it storms or before a period. So often it's a combination of triggers that are involved. Many people will tell me on vacation I don't get headaches, menstrual, hormonal, or otherwise. So all these factors play a role.
Would you recommend MigraLeaf? It's a combination pill of feverfur, magnesium, and riboflavin.
Yes, I'm very familiar with this supplement, and it makes it a bit more convenient to take 3-in-1. I usually recommend starting with one at a time because any supplement can cause side effects. Particularly herbal ones can also cause an allergic reaction. It's very rare, but I think the magnesium by itself often is sufficient. So I start with magnesium, and then I think the second most effective one is coenzyme Q10, which is fairly expensive. Costco, by the way, has the best price and a decent price and a decent quality. So CoQ10, and then riboflavin is not that effective, I find, and feverfew can be effective. So it's a convenient combination. Definitely a good combination. Can be tried in one pill, but you can also try individual ingredients.
Our next question comes from Michael. He'd like to know what you think of transcranial magnetic stimulation as a therapy for migraine.
This is an interesting and exciting potential new treatment. Unfortunately, it's not available yet. What it involves is giving a shock to your brain using a magnetic field. And it's been around for many years. About 30 years has been studied in many research studies for a variety of reasons. And it appears that if you give this magnetic shock to the brain, it stops migraine when you're having an aura, at least. The problem is it's a fairly bulky device that's being tested, so you have to carry this fairly large device with you because as soon as you get an aura, you're supposed to give yourself a little shock, and that stops the migraine. So it's not very practical, but it seems to work. But again, also, besides being impractical, it's not available yet in this country.
Our next question comes from... Yes. Our next question comes from Michelle. Someone at a health food store told me about kudzu root for preventing headaches. Have you ever heard of anything about this?
I've heard about this root, but I don't think there is any science, again, just like with many other herbs, whether it works or not. If it's safe and it's again, nature manufacturer, you think it's a safe product, it's okay to try. Many other herbs have been reported to be useful. Valerian root is very calming and relaxing herb. It's been used for many, many years. And many other plants and herbs, and ginseng and ginkgo biloba is good for your brain supposedly, but they lack good scientific studies to prove that they work. So I don't really recommend it. I recommend mostly things that we talked about that have some science behind them.
Let's see. Michael would like to know if slippery elm powder is effective for nausea when migraine patients. I
don't really know. We do know that ginger has some science behind it, but ginger helps nausea. We also, as far as alternative therapies for nausea, C-bands. These are stretchy bracelet-like bands that go on your wrist. You can buy it in any pharmacy or alternative or herbal stores. These are C-bands for seasickness. There's a plastic button at the wrist which presses on an acupuncture point. And that's been scientifically tested and proven to help even morning sickness and pregnancy. Putting those two bands on your wrists, and they cost about $6 in the drugstore. So that's a good thing to try for nausea, migraine, or motion sickness, which many migraine sufferers tend to have motion sickness. Many of them give me a history of having motion sickness as a child, and as they grow older, they develop migraine. Those two conditions often coexist.
Our next question comes from Debbie. She's tried riboflavin and it aggravated her restless leg syndrome. Is this common?
Restless leg syndrome is very common in general population, and maybe even more common in people with migraines, and definitely can interfere with your sleep and increase the headaches. As far as riboflavin making it worse, I have not heard that. But then I don't use riboflavin very often. Some patients do take it and find it useful, but it tends to be low on my list of herbal supplements, of natural supplements. But restless leg syndrome is an important thing to consider. People who fidget and jiggle their foot all the time. Unfortunately, that movement doesn't stop in sleep, and people often wake up tired and never get good sleep. and helping them with that. Unfortunately, there's only medication that you have to take to stop that, but you can really improve the quality of your sleep and quality of your life and improve headaches.
Marjorie would like to know how effective acupuncture is for migraine patients.
All right, we do have some slides on acupuncture. We have music therapy, and this is acupuncture. Again, Germans ahead of everyone. They did, besides Chinese, of course, 15,000 people with headaches in Germany were treated with acupuncture. And they found that it's not a double-blind controlled study like you can do with medicine, where you give a sugar pill. But such a large number of patients were treated with acupuncture, and they found that acupuncture was significantly effective, significantly better in improving quality of life. QOL stands for quality of life. There was a significant drop in 2 acupuncture group, and there was a control group, people who did not get acupuncture. There was much less of improvement. And there was a recent review, just came out, I think, this morning, of acupuncture studies for pain, and they concluded, these researchers did spend years of looking through several studies, actually many studies, putting all the information together and figuring out that really acupuncture works, which shouldn't be that surprising because it's been used for 2,000 years, and also because it's being used by veterinarians. It works in animals, so it's not a placebo effect. It's not psychological effect. So acupuncture definitely is effective. Problem, this is the conclusion that one of the leading German doctors came up with because of that study, showing that acupuncture is effective as drug therapy. Problem with acupuncture is that it's expensive, insurance often doesn't pay for it, and it's time-consuming. You have to go at least once a week, preferably even more. And that's the reason why I don't perform acupuncture very often in my office, because of time and cost issues. But if you can find an inexpensive and convenient acupuncturist, you should definitely try it. It definitely can help headaches as well as other pain problems.
Our next question comes from Alexa. Can you recommend any meditation CDs or downloads that will help with chronic daily migraine?
Oh, yes. There are many. One of them is on the pharmaceutical company's Merck.com. They have a migraine product called Maxil, and on the Maxil, actually I think it's on Maxil.com, there is a psychologist from Montefiore Headache Clinic in the Bronx who reported a very good relaxation tape for people with headaches. But sometimes, people prefer different voices, different sounds, so you can just Google. There are many, many free meditation tapes, some of them that you have to pay for, but they're very inexpensive, so that's a very, very effective thing to try for your headaches. So I strongly recommend progressive relaxation, meditation, self-hypnosis, there are many things to do. And there is also one website where you have to pay some money, but it offers cognitive behavioral therapy, which is normally performed by a psychologist, but it's an expensive treatment and insurance companies often don't pay for it. But there's a website based in Australia. It's called thiswayup.com. It offers cognitive behavioral therapy for anxiety, depression, and other symptoms. It's an online interaction that you take a course, and they have good scientific evidence that it works. They published many articles in scientific journals. So this way up.
Marjorie would like to know, is regular therapeutic massage effective?
It certainly feels good. I do enjoy massage myself, and if you can afford it, or if you can get the insurance to pay for it, and it feels good, definitely do it. But there's no study showing massage specifically improves headaches, but I can't see why it wouldn't, because it's so relaxing, and if you're very stressed out and tense and your shoulders are tight, why massage wouldn't help. So it feels good. If it feels good, do it.
Rick would like to know, what is the difference between biofeedback and neurofeedback, and is one better than the other?
Right. Biofeedback is a very old technique. It's been around for at least 50 years, before computers came about, personal computers at least. And it's usually, it's called biofeedback because you get feedback from a computer screen these days, where you see the temperature of your finger or the tension of your muscle displayed on the screen. You can learn how to make the tension go down or temperature of the finger go up and warm up your hands. So you get constant feedback. And the only way you can do that by deeply relaxing your muscles. And that's why Vata is so effective. It teaches you how to stay relaxed even under stress. Neurofeedback uses brain waves to give you feedback. So electrodes are placed on the scalp, and you can see a brain wave on the screen, often displayed in very, very entertaining ways that allows you to learn to control your brain waves. And it's been very popular for conditions such as attention deficit disorder in children. Now that is scientifically proven, and I think that neurofeedback is probably equally effective as biofeedback, but it's just another way to do it. A bit difficult, more difficult to learn the neurofeedback, but once you learn it, potentially benefits are better. So both neurofeedback and biofeedback are good things to try.
Debbie would like to know what is craniosacral therapy? Craniosacral.
It's a sort of a mixture between massage and chiropractic. Cranial means your head is being manipulated and massaged, and sacral is the bottom of your spine, sacrum. So it's working on your spine. Just like I mentioned before, the general principle is if it feels good, do it. If it doesn't, don't. But there are no scientific studies to prove that it really works. All right, I think that we are at the end of our webinar. You should feel free to visit our website, nyheadache.com. And if you want to read up on migraines, it's migraines.com. And there are fortunately many, many resources on the web. And National Headache Foundation has many good resources on its website. And National Headache Foundation also has a very good magazine for headache sufferers. So I would encourage you to subscribe to the National Headache Foundation and support this very important organization that supports research into the headaches and its treatments. Thank you for your attention.
All right. Thank you, Dr. Moskop, for joining us. And I'd like to thank everyone for tuning in. Please feel free to join us. It looks like September 25th, we'll do another webinar on cervicogenic headache with Dr. Wade Cooper. So please join us at this time. You all have a great evening.